As we saw in Yamisha's report a moment ago, the first shots of a COVID vaccine in Britain delivered new hope around the world today. Federal officials say they hope to begin delivering doses in the U.S. within the next couple of weeks. But there are many concerns about getting the vaccine out to those who need it in the coming months. Alex Azar is the Secretary of Health and Human Services. He was at the President's Summit today, and he joins me now from the White House. Secretary Azar, thank you very much for joining us tonight. I want to ask you first about what Pfizer, the pharmaceutical company, is saying. It's saying that it's told the Trump administration that it cannot provide substantial more doses of the COVID vaccine by the middle of the summer because the administration basically declined to purchase a second batch of doses, and that now other countries have bought those up. What happened?
So, Judy, what Pfizer's telling you is simply inaccurate, and unfortunately they seem to be wanting to do contract negotiations in the media and thinking that this can somehow pressure us. Let me lay out for you what happened here. Back in July, before they had even initiated phase 3 clinical trials, we contracted with Pfizer to buy 100 million doses of vaccine sight unseen if it got approved by the FDA. Regardless of efficacy, safety, whatever else standards, as long as the FDA approved it, we agreed to buy it, as long as they could deliver by the end of March. They refused to commit to any other production or delivery by a time certain. So we did a 500 million dose option on top of that we could then negotiate and execute against, because I'm certainly not going to sign a deal with Pfizer giving them $10 billion to buy vaccine that they could deliver to us 5-10 years hence. That doesn't make any sense. And that's on top of course, the 5 other companies that we secured 100 million doses from each. In early October, again, before we saw phase 3 data, we commenced negotiations with Pfizer to extend, to do one of those options on vaccines. They still resisted giving us any date by which they would do it. We're making progress. We have made it clear, though, we will use every power of the Defense Production Act to ensure the American people's needs are satisfied, and I'm very confident that we will get the vaccine we need and want from Pfizer.
I'm asking you just very quickly, Mr. Secretary, because the optics of it, what it looks like is that even with all the lives, people's lives at stake, the administration decided the money was not worth it.
No, Judy, that's actually completely inaccurate. Remember, this was back in July. They didn't have a vaccine. They had a phase 1 vaccine that hadn't even entered into phase 3, and we gave a guaranteed $2 billion purchase of 100 million doses, Judy, and we secured a 500 million dose option. And at the beginning of October, before even seeing phase 3 data, we've been negotiating with Pfizer to get them nailed down on a date by which they would commit delivery. Now, I think we're making progress.
Well,
Pfizer's negotiating in the media. That's not appropriate, and they know better.
Let me ask you this. By what date do you believe all Americans who need a vaccine have a vaccine?
Yeah, we believe between Pfizer, Moderna, and the other vaccines that we have invested in and are bringing forward, we believe that in the second quarter of next year, there's enough vaccine for every American who would like to be vaccinated to get vaccinated.
So that's by the end of June, roughly.
During the second quarter, right. And this will be progressive. This is not a single moment in time event, as you know, Judy. We'll have 20 million people vaccinated by the end of just this month. And we had this vaccine summit today with a bipartisan group of governors, our retail chain pharmacies, our distributors, FedEx and UPS, to demonstrate just how well-oiled this machine is to get vaccines out there. Our governors said they'd have 100,000 people vaccinated within 24 to 48 hours.
Well, that's what I want to ask you. What exactly is the plan for dividing up the vaccine by state? And where does the federal responsibility end and that of state and local leaders begin to make sure that everybody who needs a vaccine gets it?
Yeah, so it's been very transparent. We are allocating the vaccine as the governors requested on a per capita basis, population 18 and over in the states. We buy the vaccine, we pay for the distribution of the vaccine. Through us and private payers, we pay for the administration of the vaccine. We ask the governors, because they know the lay of the land, to tell us where they want the vaccine shipped. And we direct the shipment either directly from Pfizer in the case of their vaccine, or through McKesson, the world-leading distribution company, in the case of the Moderna vaccine. It then goes to CVS, Walgreens, a hospital, a community health center, a public health lab, whatever the governors have according to their plans. They're almost like air
I'm
traffic
asking-
controllers within their state.
I'm asking in part because what we've heard from President-elect Biden is that he has not seen, that his team has not seen a clear plan for distributing the vaccine from the place where it gets shipped into the country, from where it's manufactured, into people's arms.
I'm sorry, it's just not true, Judy. We're incredibly transparent. I do with General Perna and Dr. Slaoui an hour-long press briefing every single week where we walk through in minute detail, down to dry ice levels, how this is being distributed from the manufacturing plant to the distributor, to where the governors have told us, how we have kitted 100 million kits at McKesson of syringes and needles and PPE to have that happen. Every item is microplanned. Judy, this is the United States Army that is planning this out with the nation's leading distributors and shipping companies. As they say, this is what we do. We are using the tried and true tested system that gets hundreds of millions of vaccines and flu vaccines out every single year. Don't invent a new system when you have one that works.
Yeah, I'm also asking in part because there are local leaders who are saying they need more resources. They need funding in order to get the vaccine into every individual, whether it's in urban areas, rural areas. There is concern about that.
Well, Judy, as I've described, we've actually set up these partnerships with CVS, Walgreens, Kroger's, with our community health centers, our hospitals, to really take that burden away. Now, money's not going to be the barrier to ensuring, especially that our underserved get vaccinated or others, so we'll make sure that that is available. But it's also important that they understand, because there are a lot of myths out there about what the role is. The states and the local governments are not being asked to set up vaccine clinics, but rather to leverage the systems that already help get people vaccinated every single year.
Mr. Secretary, the United States, as you know, has 4% of the world's population, but it has 23% of the cases in the world of COVID-19. How did that happen? How did this administration oversee a situation where it is so disproportionately affecting the American people?
Well, Judy, as we just talked about, we're on the verge just days from having vaccine, and we are concerned about the number of cases, the hospitalizations we're seeing in the country, and we're asking people, please, please act responsibly. We want everyone to get to the day where they can get vaccinated, and that means washing your hands, watch your distance, wear your face coverings when you can't watch your distance. Please be very careful.
But that
about
message
indoor
has
gatherings.
been a mixed,
It is.
message, excuse me for interrupting, has been a mixed message from the very top, has it not, Mr. Secretary?
Judy, every one of us who support and work for the president, the vice president today at the summit made clear those 3 W's, and be careful about indoor gatherings, overcrowded indoor restaurants, overcrowded indoor bars, and household multifamily, multi-household gatherings. These are settings of disease transmission, and I need your viewers to please be very focused on this as we approach the holiday season. Be careful, because I want to make sure that next year's holiday season, everybody is able to be together for a normal holiday season because of the vaccines that we're working together to deliver to you.
Dr. Alex Azar, the Secretary of the Department of Health and Human Services, thank you very much.
Thank you, Judy.